Morning, everybody. So lovely to see you all and your names. I wish that we could all be sharing, or not sharing a cup of coffee, but I'd send you all coffee and we could be having coffee together or tea, whatever your preference is. Welcome, welcome, welcome on this beautiful morning at this point. Let's hope it stays this way. You all are in for a treat this morning. Thank you all for getting up early, joining us. This is take two of this presentation. Dr. Russell presented for us last night from 5 to 6, and we had a great crowd over at the med school. But this morning, I don't think you will regret being here early. We've got Dr. Regina Russell here presenting to us on artificial intelligence in medical education. Now, Dr. Regina Russell is Director for Assessment and Evaluation at the Vanderbilt University School of Nursing, an Associate Professor in the Health Promotion, Populations, and Health Systems community. She's a social scientist who focuses on the description and measurement of performance to support learning and educational improvement. Dr. Russell holds graduate degrees in higher education, sociology, and public administration, and her professional experience includes social work, nursing, and medical education. Dr. Russell is active in the School of Nursing Center for Research Development and Scholarship and the Vanderbilt University Data Science Institute. Her recent collaborative research includes studies of competency-based assessment, artificial intelligence competencies for clinicians, experiences of first-generation college students in medicine, and the application of large language model to grant evaluation activities. That's a lot. That's a mouthful. You'll see how all of her experience comes together in a 1-hour presentation. I'm going to turn it over right to you, Dr. Russell, and I will see you all in a few.
Excellent. So let me share my screen. Good morning, everyone, and thanks for getting up early for this. I expect this is maybe the early bird crew. Can you hear me well? Can I get a thumbs up? Is that okay? Excellent. So let me get my, oh, you don't need my email. Let me get this screen share. All right. How's that? So, make sure I can see here. Excellent. So thanks for that introduction, and thanks for the invitation to come speak with you all here. And it's been my first visit here, so I'm learning a lot about your institution and also your wonderful city. Thanks to the continuing professional development team that has been organizing my trip and helping me get ready for all of these discussions. I would like to acknowledge that I expect there are a number of people in this call that have experience with artificial intelligence or and definitely health professions education. So I would love to hear your feedback. I'll save time at the end for questions, and I hope that you will write some notes maybe about what you're hearing. And I will say that a lot of what I'm saying won't be necessarily new. Some of it is research that I'm sharing that's new, but some of it is really connecting some dots, I think, between what we've been doing in health professions education and what's coming and what's here now and what's coming with artificial intelligence. So if this, I know that we're recording, so if you're watching this in the future, it's March 2024, early March now, and the talk is Artificial Intelligence and Health Professions Education. And this is the Teach Grand Rounds at Virginia Tech Carilion School of Medicine. And I would just like to say hello to my mom and dad in Arkansas in case you are watching this. Oops, get the going forward. So this is just sharing some disclosures about funding that I received for some of the research that I'm going to share later in the talk. There was a collaboration between Vanderbilt University Medical Center and IBM Watson Health, where they were interested in looking at artificial intelligence in healthcare. And so that was a large multi-year collaborative, and there were small grants off of that. And I was part of a small research grant. The PI is Dr. Bonnie Miller, and I received 10% effort to work on this research project. And I would say I was invited because of my background in medical education and competency-based education. So I am not a computer scientist. I've learned a lot about artificial intelligence during this project, and I hope to share some of that with you. This study was conducted, that I'll talk about later, in 2020 and 2021. And this is an interesting article from the New York Times that came out in 2021. IBM Watson Health, which was the company we were collaborating with, closed at that time. And IBM Watson is still around, but not the incarnation of IBM Watson Health. So you might be interested to read this article about the backstory of sort of tech development in healthcare and some of this early efforts that they made. Also, I want to point out that the graphics that I'm using in this talk, I generated with Adobe Firefly, which is a generative AI, creates images based on prompts. So I would say, you know, I want some futuristic pharmacy bottles and some old textbooks and the background to look a certain way. And you can, Adobe, since it's a design tool, allows you to choose certain design elements. So I just want to let you know that this is a contribution of generative AI to the talk. And I hope that it helps us think through some of the implications on many levels. So the learning objectives for today are what I hope that you get out of the talk and that we do together is that you would be able to describe the expanding influence of artificial intelligence-based technologies in the broader society, in healthcare systems, and particularly in health professions education, because this is a Teach Grand Rounds. And we're going to review the proposed competencies that our team developed through this research project, and so that you would leave with some awareness of what that competency set looks like and how that might be incorporated into health professions education. So the structure of the talk today is I want to talk a little bit about foundations and futures. I want to focus our attention on some things that we already do well and we know in health professions education are foundational to our work before we start talking about potential futures, sort of what's coming down the road for us. I will talk a little bit about the collaborative research that we did and specifically the competencies for the use of AI-based tools by health professionals, which was the outcome of that research. But throughout the talk, and particularly as we get to the end, I'd like to have more discussion about the role of educators and education systems in this change. So a lot of has been driven by computing, computational power, but now it's in all of our domain. And so part of what I hope to share, and this is, I was asked by the team to come up with a tagline for the talk. If you could walk away with one thing, what would it be? And this is it. I would say, I hope everybody walks away with an awareness that education is necessary for the responsible use of AI-based tools in the health professions, and that's us. And so the educators really need to be in this discussion and thinking about how we're going to evolve this future together. This is just a little bit of grounding. This is Dean Dr. Bonnie Miller. She was the Senior Associate Dean for Vanderbilt University School of Medicine when I worked there for about 15 years. And she really helped me understand the landscape of health professions education and where competency-based education fits in there and how we can think about futures in health professions education where people can come in and out and move into different learning based on what they need, based on the competency development that they're working on within a framework of required competencies, right? So this is the institution that I'm coming from. I'm at Vanderbilt University, and in the foreground, this is the old campus. This is old, university buildings, all these old brick, kind of academia, I guess you might call. And in the back, this is our medical center. So Vanderbilt University Medical Center, all these shiny buildings and the cranes that are coming up very fast. When I worked at the School of Medicine, I worked over in this environment and it moves very fast. And that was something that I learned. I come from higher ed my whole career, but working with healthcare providers, seeing just the urgency of that space, they are moving much more quickly into using artificial intelligence-based tools, and we're already there when we were doing these interviews. This is before the generative AI boom. But I would say that is really was sensitizing to me, to be aware of how fast paced the environment is, really people's lives on the line and people running fast, trying to figure out how to use these tools to the best effect. And I would say academia is a little bit more careful and a little bit more, thinking about what are the implications of this going forward and how do we want to use it. And my sense is we've really got to bridge those two conversations, and people in health professions education are doing that all the time. So I'm going to next move into some conversation about what I think we already have built in health professions education that will be helpful for us moving forward into these different alternative futures. And this is a shout out to Dean Miller. I would say also she was one of the first female surgery residents at Vanderbilt when she went there. So just really a trailblazer and has been thinking for a long time about how we can do education more effectively going into this future where all the information is available to us, but it's about critical assessment, understanding what is good information, what has quality evidence behind it. So the first foundation, and I've already given a clue about this, I think is competency-based education. And we've been moving down that path ever since I've been in medical education. It's been a priority, and it's been one of the areas that I've focused my energies on, is thinking about, and of course, I am reminded that the residency programs in GME had started in competency-based education and medicine way earlier than I showed up. And then we went about trying to build competency-based assessment for our undergraduate, our MD students, so that as they moved along their pathway, they would align with what was expected of them in residency. They would understand the language of the competencies, and they would be able to drive much of their own learning because they knew what they needed to work on. So those of you who aren't as familiar with competency-based education, the idea is we're working from professional competencies, knowledge, skills, and attitudes that are necessary for practice. And there can be basic competencies that everybody needs, and then there can be specialized competencies that you might need if you're an anesthesiologist compared to a geriatric care provider. It is in these professional communities that competency requirements are determined. So what filters into health professions education is part of what's expected for people that will be working in those fields. Can consider healthcare ethics one of those areas that everybody has to learn about before they can be licensed as a healthcare provider, because the implications are so profound of the possibilities of harm for individuals. So why do competency-based education? One is to take it out of the time-based idea. Everybody may not need 4 years to get an MD degree. Some people may need longer, some people may need shorter. It's not the time that somebody spends, it's whether they can do the things that are expected for them to do in practice. Are they safe? Can you trust them? Competency-based education, as I noted, is very learning-centered, which allows you to also the learner to center on what it is they need to learn, and good assessments as the priority. So good feedback for people about how they're developing, and including in clinical, really good clinical feedback. We see some of this work and assessment coming through in milestones. I've done some of that work, and in trustable professional activities. How do we know when people are ready and how they're progressing? Supervision, licensure, and continuing education, continuing professional development are all part of a competency-based framework for lifelong learning and development. So that's one foundation. Another one I think is interprofessional teamwork. Interprofessionalism in healthcare is just required. It's part of how I don't have to tell you all this, but it's how it works. I would say also from a patient perspective, we see all the different people that work on care and think of them as a team. And the development of tools and technologies using artificial intelligence also needs to be co-developed between teams of people that really know how to do the code, know how to build the tools, but also the people who are going to be applying this in practice. What's useful, what's appropriate, what's not appropriate, what's ethical, not ethical. And I would say that all of the professions in healthcare are facing similar challenges of rapid change. This is all happening to everyone at the same time. So I've recently moved to the School of Nursing, and we are facing the same technological environment, artificial intelligence coming in through many different avenues in healthcare and education. And then the third foundation I would like us to focus on is the idea of evidence-based practice. And this applies across the health professions, also in education, the expectation that there is some evidence for the ways that we do things. We don't just sort of make it up as we go along, but we work in a community of science and communities of practice that are working on best practices and sharing that. So whenever we start thinking about new tools or technologies that we might use, I always think it's a good question to ask, what's the evidentiary basis to evaluate these tools? How do we know if they're high quality, if they're doing what they're supposed to do? But also, how can the new tools contribute to our evidence-based practice? What new ways might we be able to learn with these new capacities? And then relevant to the question that we were asking, what do frontline clinical users need to know to evaluate what's happening with these tools and if they're being used effectively, appropriately, and ethically? So moving from the idea of what we've already built, what we know, to the future, what's coming with artificial intelligence, I would emphasize that, oh, I'm sorry, go backwards. I would emphasize that artificial intelligence is not a new thing. It's been around longer than I've been alive. Their computer scientists have been working on this challenge of how to get computers to think more like the way humans think, and computers don't think, they calculate, but to be more functional in providing decision support. That's the language that many of you will be familiar with from working in health systems. But how can we get the computers to do more of the work that would help humans and do it in ways that are more intelligent, that they can take on more of the work and we can guide that work. So artificial intelligence really at its base is a bunch of computers networked together, calculating off of a lot of data that gives clues and insights about what is the expected next thing to do. So it isn't, sometimes people will say, you know, like it's intimidating and I don't understand it. And there's a lot of words used like machine learning and neural networks, deep learning, a lot of tools and approaches that are used in artificial intelligence that can seem overwhelming. And, you know, if you're not a computer scientist, feel like that's not really your place. But at this point, it's in all of our workflows in our lives. So understanding sort of a little bit about what's underneath is helpful. Much of what we've seen in healthcare are things like risk scores, algorithms that provide predictive capabilities, probabilities of patients having certain outcomes or disease states, and then providing some support for clinicians about this might be some option that you would take. There have been a ton of applications for artificial intelligence in engineering, you know, industrial, you know, factories, having robots building cars. All of these things have been developing for a long time, but they've been, I would say, more specific use cases and not as publicly available. So now we're seeing them in our cell phones where the, you know, you'll look for a pair of shoes and then your phone will, to Amazon will say, hey, you were looking for some shoes. Here's some other shoes that you might like that look like those shoes. So there are so many applications of it, and it's coming in so many ways in our lives, many ways that are incredibly helpful and reducing work, but in other ways that raise flags and concerns about, do we understand the implications of that? So I would point out that there's ongoing research and development in computer science communities, informatics, data science, just a huge amount of development around how we use all of this data that's coming in at this point to train machine models. And a distinction that's helpful, I think, is between when we talk about artificial intelligence, it can mean a lot of things. And I always like to say artificial intelligences because it's not one thing. It's a lot of different tools. That's why we use the term tools with artificial intelligence technologies embedded. But a lot in healthcare, we're talking about specific use tools. So tools for monitoring patients' diabetes in a very specific use case. And a lot of what maybe is more in the public is the idea of kind of a general intelligence, the sci-fi kind of idea. We're not there. I think there's a lot of people who would like to get there, but we have a lot of ground to cover in terms of what that might look like. What are the policies and the guardrails? And so I'm really talking a lot about specific use tools here, but generative AI is kind of a general tool that it's not a general intelligence like, HAL or something, but it does start people thinking down that path and talking down that path. And so it's helpful for us to think about what's now and what's coming and how we need to fill the gap in between or shape the future of what we want to see coming. So on cue, anytime I start talking about artificial intelligence, I want to raise the flag about ethical challenges related to this. And they're large. There's a lot of concerns around the increasing use of artificial intelligence in society, in healthcare and in education. So a few of those things around safety, particularly in healthcare. Do we know that the risk predictions are of high quality? Depends on the model that you have, depends on the underlying data that was used to construct that model for predictions. That those data sets can misrepresent populations. So you can train your model to make predictions on one population set. And when you apply it in another group, it doesn't work for them. And that can be a huge problem because a tool is sold saying this makes good predictions for breast cancer. But if it's in a primarily white population and then it's put in another population, it may or may not work the same. I've labeled that as training data misrepresentation, but representation or misrepresentation. The sourcing of data, where does all this data come from? Is it ethical? Does everybody agree that they can be tracked all the time with their cell phone, everywhere that they go and all the questions that they ask in Google? We do agree because we want Google to tell us the answer. So there is a bit of back and forth about those things. Definitely bias. And there's a lot of conversation if you haven't, been hearing about bias in AI. Welcome to the party, but there's a lot of concerns about how, not just the underlying data sets, that's a huge source of bias, but everything that's built by humans has embedded bias in it about how we plan to use it, how it works in systems. And so thinking and talking about those things at the front end is really important. Privacy, also, like I said, what you can be tracked on your cell phone. There's now sort of teddy bears and different types of dolls that families of patients can put in hospital rooms to track healthcare providers, what they're, how often they're coming, what kind of things they're saying. So there's not just privacy for patients, but also for whole systems in terms of tracking and monitoring performance. Intellectual property. I always tell people I'm from Nashville, and you can't just scoop up all the songs and not worry about how the creative people are going to be paid. So, who owns the copyrights and the intellectual property? That's an ongoing issue of ethics and use of artificial intelligence. But also there's just large human impacts as our systems change radically, economic changes and environmental costs. I was talking with someone the other day about artificial intelligence, and I said, artificial intelligence is very resource intensive. It takes a lot of energy to run these data stores, to run these analytical models. The large language models are costly, and that means costly on the planet and environmental resources. So we, I think, have to talk about this in a balanced way and how we're going to choose to use these powerful resources. There's a great book by Kate Crawford that came out in 2021 on Yale Press. She's a professor at Stanford, and it's called The Atlas of AI. Power, Politics, and the Planetary Costs of Artificial Intelligence. I would recommend that to you if you're interested in sort of some of the deeper policy issues and some of the larger economic and environmental consequences of these growths. So the work that I did was the research that we did was in 2020 and 2021. And so that was before ChatGPT exploded on the world. So I want to, call out this new set of tools that we call generative artificial intelligence that's able to create, which is different than many of the tools that have been in the past that are, even before artificial intelligence, much more rule-based, much more constrained. So now we're talking about tools that can create, can develop new sets of workflows, text, generate whole papers on their own. You've probably seen these things. So I wanted to point out where that's coming from. There have been huge computational advancements in the last decade around natural language processing. And so that's the ability of computers to read text, just like your Siri on your phone or whatever, if you use these tools, talk to the computer and the computer understands our language and can process based on just I don't have to learn code. I just can speak in my own language now. That is a huge advance, and that's what's enabled this, ChatGPT world. Also, processing power of chips has greatly advanced, and the storage capacity, having these large data centers. There's some that you can see from outer space. So that has been great technological advancements that have created this infrastructure that's different now than we've had in the past. And so I like to think about that as we're in 21st century digital and social environments, and that's different than what people have had in the past. And we need to think about that pretty hard. And I think in the professions come up with competencies, guardrails, guidelines, expectations, and ethics around these new tools. The type of generative capabilities are incredible. Many of us have used the ChatGPT for text. These image generation, I asked Firefly for this picture, show me some of the ways that generative AI is being used. And this is what it came up with. These are, different in the back. This is what the robots are generating. But generative AI can also generate audio, video together. 3D, we now have 3D printing, so you can, tell a generative model, come up with something, a picture or a 3D image of something, and then print that in plastic. So we are now in multimodal world with generative artificial intelligence. And this is now accessible to lay users. I have a nephew with a 3D printer in his garage, right? He can make all kinds of things. So there are extensive ramifications for this at the individual level. What should I use? What shouldn't I use? Processes in institutions, policies, and thinking about the whole organizational landscape, the way we've always done things, the way we think things ought to be done, including in our institutions, academia, healthcare, but also the professions. What are the guidelines in the professions? And of course, policy related to governments, local, state, and federal. I have two slides here talking about futures, one related to healthcare, and the next one I'm going to talk about health professions education. I've kind of aligned them the same way so that we can talk through some of the current uses and where it's likely to continue growing. So I'd say administrative teams are already using artificial intelligence, a lot built into the electronic health record, finance and billing systems, workforce management. Clinicians are already monitoring care with certain types of artificial intelligence tools, giving, heads up and alerts when things are going in directions that need attention. A lot of potential for our diagnostics and use of artificial intelligence for diagnostic purposes. Just looking up information, keeping up to date with information and communicating, there's a lot of communication that goes between clinicians and patients. And so how can that be streamlined? How can artificial intelligence help with some of that burden of documentation? And then patients also are using artificial intelligence-based tools. Many people have health tracking technologies, watches, keeping track of their blood pressure, their heart function, et cetera. And they also use artificial intelligence to seek information about diagnosis and management of their own conditions. Some people find this frightening, and some people find this as a way to continue growing individual patients' own knowledge and awareness of their health and how to collaborate with their care providers to continue to be healthier. So a number of the tools down here at the bottom of natural language processing is huge. Being able to use natural language processing on electronic health records and notes. Many of you, I'm sure, have been involved in that research or seen that research. The integration of large language models, that's happening everywhere and will continue to. Computer vision, and I always think it's helpful to share that computer vision has two different meanings. In the computer science world, computer vision means that the computers are able to use video to see what's going on, to take that input in order to, provide feedback or decisions or information. So the computers can see computer vision, but the eye doctors, the optometrists, call computer vision that condition when your eyes are very blurry and tired because you've stared at a computer screen for too long. So I think there's a lot of even development of the concepts and the health concepts around all the computering that is involved with these new technologies. Robotic surgery requires computer vision for the computers to be able to robotic arms to be able to get that input about where you are in space and what needs to happen next. CareBots is a whole area of development. I have a friend who's working in that area in the future. I hope that if I'm older and I need care in my home, that I might be able to have a CareBot that connects with the healthcare system in ethical and appropriate ways to make sure that I'm on track and help me continue managing my health. Predictive modeling, as we discussed, and talk about that a little bit more, risk scoring, data that comes from electronic health records, and even at Vanderbilt, we have a huge genetic database that's connected to the electronic health records. So the type of information that we can find out about individuals and population groups using these artificial intelligence-based machine learning and predictive modeling tools, it's very powerful and does require a lot of thought and guardrails, policies around how that information can be used. And again, diagnostics and imaging. Imaging is an area that has really just boomed with artificial intelligence. There's a radiology and AI journal already that's just talking about how artificial intelligence-based tools can be used in reading images and providing information about what's in them, often as a second reader or a third reader to a human. But they are very good at being able to pick up anomalies. That's actually one of the great strengths of these types of tools is pattern finding and picking out anomalous information. So now that we're thinking about, this is already in healthcare, it's already happening, and it's going to continue to grow. That's what I'll talk about in just a few minutes, the interviews that we conducted. But that means it's also in health professions education because we're preparing people for their careers to work in these health systems that have a lot of embedded artificial intelligence. So even before ChatGPT exploded in healthcare and the world and education, health professions education really needs to think and focus on how these tools are going to be used by the students who will become providers, caregivers in the future. So already same administrative teams, things like enrollment management, evaluation, systems improvement. People are already using artificial intelligence-based tools or testing them for these purposes. Educators are already thinking about content development, course support, assessment related to these tools or how these tools might be helpful in those processes. And learners, same as patients, are trying to monitor their own progress and information seeking about what they need to know next. And these tools are incredibly helpful for them sometimes. Same natural language processing, large language model integration into education. We might think about ways that education has benefited from and will continue to benefit from automation. Like CareBots, we might have coach bots where every student has a guide in their machine that's helping them know what's the next experience, what's the next thing that you need to learn to build your competency in areas that you need to develop. Predictive modeling based on student data mining is the same concept, developing algorithms about which students might struggle in different contexts or over time and how we might help them, or how students might be able to move faster through programs if we give them more guidance, more information. Assessment of students in simulation using computer vision, virtual reality, those are all happening now. People are testing those now. So that was a long introduction to the research that I'm going to share with you, but I wanted to really ground us in what we already know and what these tools are before I shared with you the study that we did. So this was a research collaborative between IBM Watson Health, Vanderbilt University Medical Center, and I was the representative from Vanderbilt University. And our question was, what are the competencies necessary for the ethical and effective use of artificial intelligence-based tools in clinical settings? So there were already some competency statements about what do informaticists need, what competencies do they need about artificial intelligence that were a much higher level that involved, knowing how to understand the underlying code. But this is really about every single person who works in a health system and provides care for other humans. What do they need to know about how these tools might impact their decision-making, impact the flow of care, and helping to make good decisions about how to use these in healthcare. So this is a picture of just the timeline of our study. And in spring 2020, we conducted a scoping review, and I'll share that slide with you in a minute. And in the fall of 2020, after looking at that, all of those articles, we developed an interview script about asking experts across the health professions, but particularly people who have been doing a lot of work publishing research and development in artificial intelligence, to ask us, what do you see now? What do you see coming 10 years from now, 5 years from now? And what do you think that clinicians are going to need to be prepared for? What competencies do they need? After we interviewed those folks, and I'll share that with you more in a minute, we drafted a set of competencies, and then we sent those back to our experts and said, did we get these right? Give us feedback. And we adjusted those competencies, and then we published those. They came out in the spring of 2023. And the citations are here if you're interested in following these links. I think this presentation will be available after. But this was the first work that we did, was a scoping review. And we were looking really at what type of competencies have been written about, what type of expectations for education and learning for humans are necessary when we're looking at machine learning models in healthcare. And you can read this paper that has our entire search strategy, but I'm just showing the one picture that we started based on our search strategy with 3,400 records. But after we went through the process of reviewing and selecting just the articles that focused on competencies or some type of statement of human learning, we came up with only 4. And so that's very concerning, for there to be 3,400 articles about machine learning and the use of machine learning in healthcare. And most of them are really just about how the tool was developed or what the tool can do. And sometimes it's about how the tool might be used in conjunction with a human, but without discussion about what the human needs to know to manage the tool, to understand if the tool is working correctly, to be part of that process. So we felt after we did this, we were on the right track, and we wanted to go forward with the interviews and ask, well, let me say, before we did the interviews, this was our second paper, which was really just a statement, a commentary that what we saw in the literature was a lot of AI-related health innovations, risk scoring, image analysis, clinical decision support, a lot of patient-generated data, but that this connect between clinician competencies and all of these innovations, there was a big gap there. And so we wanted to focus on that gap. How can we build in learning activities and assessments for clinicians, both general competencies for artificial intelligence and specific for a type of tool like robotic surgery? You need very specific competencies as the human surgeon to run robotic surgery. So this is just kind of a graphic representation of what we see as a big gap in education and in our education conversations about preparing future clinicians. These are the experts that we interviewed. We interviewed 15, and we call them subject matter experts, 15 SMEs, and the professions that they came from and their areas of expertise. every person on this list was working at the front end of health informatics, bioinformatics, nursing informatics, pharmacy informatics, and have been thinking about this for a long time. And so all of these people are very positive about what the potential is for artificial intelligence, but they also gave us a lot of things to think about in terms of how the larger community should move forward together. This is the paper I think that was shared in advance of this talk, Competencies for the Use of Artificial Intelligence-Based Tools by Healthcare Professionals. It was published last year in Academic Medicine. And it provides, this is our table of, or our picture of the high-level competency domains that we expect every healthcare professional will need. So I'm going to talk about these in a little bit more detail, but to show that under each of these domains are specific competency statements that our subject matter experts and our group's combined process of sorting through what they said and developing competencies, we came up with these set of statements. And I always, again, highlight the social and ethical implications because I think healthcare and education both sit in that space a lot, thinking about the social implications and the ethical implications. And so while workflow analysis and many of these other elements are critically important, we also need to spend a lot of time here and going back and forth because as these tools continue to evolve, the implications, social and ethical, will continue to change and evolve as well. So I'm not going to read all this to you, thank goodness. I'm just going to highlight the high-level competency domain, and then you can see the statements below. These are in the paper, and this presentation will also be available to you if you want to dig deeper. So the first is everybody's got to have some basic knowledge of what artificial intelligence is. So that competency would look like be able to explain what artificial intelligence is and describe its healthcare applications. That doesn't mean look under the hood. It's more like driving a car than fixing a car or building a car. But these are the specific statements there. For social and ethical implications, the large framing domain is to be able to explain how social, economic, and political systems influence AI-based tools. They're not in a vacuum, and they're not bias-free, and they're not free of sort of economic and political interests. And so understanding or having some awareness about how these relationships between technology and human systems impact justice, equity, and ethics is really important for everyone as we continue to adopt these tools. Workflow analysis, this is already happening. Every clinician is probably aware that the electronic health record changed their workflow in many positive ways and some frustrating ways. But the electronic health record is something that is a massive boon for artificial intelligence because of all of the data that's available there. So understanding the implications for workflows and what we do in our jobs, education included. So be able to analyze and adapt to the changes in teams, roles, responsibilities, and workflows that are resulting from the implementation of these tools. It's happening now, and the expectation of our experts is that it will continue to grow in a very rapid way. AI-enhanced clinical encounters carry out AI-enhanced clinical encounters that integrate diverse sources of information to create patient-centered care plans. Well, as we think that most of patient data currently lives in electronic health record systems, what about all this other data that patients will be collecting and carrying around? Who owns the data? How do we combine those data sources to help make good decisions in collaborative, patient-centered healthcare? I like this one, evidence-based evaluation, because I like to think about evaluation. That's part of my job. But every person who has some responsibility for use of these tools has to understand how to evaluate the quality, accuracy, safety, appropriateness, and biases of these tools and their underlying data sets when they're providing care to patients and populations. This is hard because many of the tools are not easy to understand what's going on, how the decisions are being made, what information is being used. Some tools are proprietary and they don't want to share that information because that's sort of their business model. So every person that is taking a prediction and applying that to a patient case needs to understand where that comes from. And so whether that is the individual person that's reading what is called a model facts sheet, kind of like a dietary label. I apologize for the balloons. that happens on occasion. Everyone will need to have some understanding of that. And even if you're not doing it yourself, do you have a group in your unit that you can go to and say, hey, how does this thing work? It doesn't seem to be giving me answers that make sense in my context. So putting this evidence-based evaluation in the hands of every user is really important, but also a very heavy lift for understanding these tools. And so that's where this final domain comes in: practice-based learning and improvement, participate in continuing professional development, and practice-based improvement activities related to the use of AI tools in healthcare. And I would say education. Are you continuing to learn? I would say this is a great example of that for education and the health professions, is continuing to be in this conversation, learning what are the things that are happening and what is my responsibility in that development. And I would also emphasize that it's not going to be the same for everyone. There will be these basic skills that everybody needs to have. But if you're working in anesthesiology, the tools that are available to you and that will be expected to be used in your specialty are different, like radiology. And I would also say that some of these tools, and I work in a very high-tech environment, but some of these tools just are not going to be available in low resource setting areas. If you don't have electricity, you don't have artificial intelligence. So we also need to be considering the implications across the field, across professional fields, and across many contexts. If we teach everybody how to do healthcare with using their AI bot to help them, what does that mean if you don't have an AI bot in that moment? One last slide on healthcare ethics specifically, and some quotes from the people that we interviewed. One, that healthcare is about humans first, and continuing to prioritize humans in this technological artificial intelligence future is really important. And one of, there's some papers about trustworthy AI, but the number one is that humans are driving, humans are deciding. I will say this, warning, proceed with caution is just a summary of what we heard from these experts. They want to proceed. These tools are very powerful. They have great potential to do good in the world, but they also have potential to do harm. And the professional communities are going to have to get their arms around what that means in each context and proceed with caution. This is a quote that I always like to share. We have seen what AI does when it ignores equity and inclusion in criminal justice, in education, in housing, and you name it. We should not have done it in those fields, and we certainly cannot do it in healthcare. So this person just really prioritizing that the healthcare environment with vulnerable humans who are trusting, sick people, are trusting that we are using these tools for the best intention for the care of them individually and for populations that we're responsible to help. This is the final paper that we published out of this work. It's called Clinical Use of Artificial Intelligence Requires AI-Capable Organizations. And I'll give credit to Dr. Lori Novak here, who's an anthropologist working in biomedical informatics, which is a fascinating combination of sort of, peeking over at what the computer scientists are doing from an anthropological lens. And this was published in JAMIA. This is the Journal of American Medical Informatics Association, Open, in last year in 2023. And what we're emphasizing here is we did all this work in this space that I'm circling here about competencies, individuals needing to understand what is artificial intelligence and how is it impacting my job and my profession. And that's super important. We need that. But individual competencies, individual people work in systems, and organizations need to be capable. They need to be AI tuned. There need to be infrastructures that are basically outside of organizations, laws, pervasive enabling resources that allow organizational capabilities to be up to speed on the AI-based tools that are incorporated, so that every individual can use their own knowledge and competencies and ethical understandings to be effective in those organizations. If we don't have the infrastructures, if we don't have the organizational capabilities, you can individually be competent, but our systems will not be competent, and we will not put out successful outputs that we're expecting from healthcare and education. So I would emphasize, while this is all healthcare focused, we need the same thing in education. Competencies are system dependent. So an individual educator is working inside of a health education system that also needs to be AI competent. So this slide, I just want to draw your attention to all of the policy and regulatory implications. We talked some about these: safety, privacy, high level intellectual property, cybersecurity. All of this data needs to be protected. The more we pile data into data sets, the more vulnerable that information is to theft and misuse. As I discussed, infrastructure and costs are really important to consider. But what we're talking about today is professional communities. And I think education professional communities, health education professional communities really need to be thinking in this space about guiding with ethics, which contexts are appropriate and not appropriate, what are the guidelines for responsible use, how will we monitor over time. And I've got this super highlighted and bolded, but education, how will we continue to teach about this so that the next generation and the next generations continue to be better prepared to use these tools to the best effect and make sure that they aren't being used generating unintentional harms. Sometimes people have the best intentions, but systems work differently than we might expect, and the outcome in a system is different than was anticipated. So back to the start here, I hope that you've gotten from this discussion the ability to describe some of these changes that are coming in healthcare systems and health professions education. We talked about the competency set that my team developed. And then again, the big tagline here: education is necessary for the responsible use of AI-based tools in the health professions. This is not just for the computer scientists anymore. I always tell people now the computers speak my language. And so I'm going to speak about this as much as I can. And I hope that you all will as well be interested in continuing this conversation. So I will stop sharing now and be really happy to take any of your questions or comments about what you've seen or what you are interested to talk about more. And my email address is here. I'm always happy to take questions. I tell people my email box is always open. So if you haven't thought of your question right now, I'm happy to take it at another time. So I did see in chat. Yes. Okay.
Nope, go ahead. Sorry.
I hadn't had a chance to look at what was going on in the chat. So please, if there are, looks like people sharing papers, links there. So awesome.
Yes, our team is awesome. When you mention a link, goes in a resource.
Incredible. You have an incredible team here, keeping you up to date.
There is no doubt about that. So what type of questions or comments do you all have? This is so much information, really just scratching the surface, getting our minds flowing in lots of different ways.
I have a question that's okay. I do have one. What do you see as the role for these new AI models for documentation, where they kind of listen to the patient as they talk and then put in their information directly into a note, so it's not even done by the provider at all?
A great question. So I'm not a provider, I'm not a clinician, and my feeling is that these tools need to be brought into systems with partnership with, clinicians need to lead these conversations. So if it reduces documentation and it helps in that conversation between the patient and the healthcare provider, then I think there might be a space for that. Do you have concerns about how that information is gathered and how that information might be used? Yes. What are your concerns and how will those be communicated in your system? That's my emphasis is there's 1,000 tools and there's 1,000 ways that people are thinking about using them. So my question is, how will your system evaluate whether they're being useful or harmful? Who gets input in that? And I would say that patients are going to continue to ask for more input about that as well, because they see the power of these tools too. So some of this is a power change, and that's uncomfortable too, or it's unclear what the implications of that are going to be. If patients have more power over their information, and clinicians are used to writing notes in particular ways that have meaning in their shared communities. Does that disrupt that practice, that workflow of how do I code something? When I write it, I'm not a clinician, but if I wrote a note, there's certain words that mean certain things that patients aren't going to write in there because they don't know. So I would think of it as an adjunct, an additional way that information might be coming into the system rather than a replacement, at least in the short term. But I will say there are a number of these tools that people thought would be adjuncts to workflow processes that eventually are much better and takes that out of the expectation that a human has to do it. And in many I would say outside of healthcare, I hear a lot more concerns about my job's going to go away because AI can do all of these things. Those of you who have been working with AI realize that it's not anywhere close to happening for most things, is not doing at that level. But in healthcare, what I hear most of the time is not my job's going to go away. It's like, oh my gosh, there's all these jobs we can never get to that take so much energy, or I have to keep repeating this same, data entry or this same, et cetera. And if we could build some tools to offload some of that burden, we could do more of the things, and I would say same in education, more of the things that you hope to be able to do. But that depends on these tools working in ways that we're not constantly cleaning up a mess, right? So James, to your comment, I think that this is a brave new world, as somebody said to me before, and the clinicians are really going to have to be in the conversation about whether that's appropriate or not. Are you a clinician, James?
I am, yes. I work in the emergency department, so I like the idea, but I'm also worried about it taking things out of context is my biggest fear for that environment.
So I love for people to say, this seems interesting and there's possibilities about that, but this is my biggest concern. I love for clinicians to be able to say, this is what I'm seeing as like really great potential, but here's the implications that people maybe work in computer science haven't thought about, right? As an emergency room physician, the patient coming in with all of their information. Absolutely. Great insight.
Thank you so much. Yeah.
Yeah, and you talked about Dr. Russell, clinicians being at the table and information technologists being at the table and all these different groups. But even when you think about clinicians, you want to have the variable perspectives, right? Because emergency medicine is going to use it very differently than pediatrics provider. It looks like Helena has a question. She has her hand raised over there.
Yeah, I was wondering about education because some of the students are learning and studying using ChatGPT, and that freaks me out because it's helpful. I use it sometimes, but when I know the content, and then I can see mistakes. So what about somebody learning something new using ChatGPT?
So your question is right on target. It's, I think, where the educators are thinking right now. At my own institution, we have set up expectations about use in education that leaves it to the faculty member. So just as Sherry said, faculty are teaching in different disciplines, and some disciplines grab this and they're like, let's run, let's see what we can do with this. And then other disciplines are like, no, we're teaching writing. And if you use ChatGPT to write your paper, you're not actually learning how to do that. So I think there's going to be a lot of variability about how it's used. I'm, as noted earlier in my bio, I'm part of the Data Science Institute at Vanderbilt, and I went to a day symposium where all of the students that are part of Data Science Institute were showing how they had trained their chatbots. So they have each different, like little instantiations, and they're training them to do different things. It was incredible what these students had come up with. And there was a group of 3 women who had built, using ChatGPT, a whole suite of tools to help each other learn. So it was, putting together notes from their classes and generating quiz questions. So it's at, maybe a more, like we're talking about coach bots kind of level. You still need supervision and oversight of, the faculty member and the educator. But these may provide, and people who have, need to practice more, we have simulations where people can do this simulation multiple times. So I agree with you, and same with James. There are big concerns, and we should be talking about those concerns, but we also should see how are they using it, and in what ways can it sort of advance our knowledge, advance our educational practice, but in conversation with what's appropriate and what's ethical, right? Not just, oh my gosh, this thing can, create anything. You've probably seen, like the image generators. There's many image generators that are just pulling up copyrighted images. Well, that's not a functional model. And we need to be training students that you can't just take people's intellectual property and call it your own. But there are potentials, I think, to really advance learning with these tools. I'm trying to learn myself how to better use large language models in ways that are bounded and appropriate.
Excellent. There are a couple of questions right in the chat. One is from Dr. Carter. The literature review excluded 48 papers from outside the US. Is it possible that insightful information from other countries may have been missed in the review?
Absolutely. I would say we talked about that quite a bit. We just had to bound our search to English language. But and we did only interview American, I think maybe it was a Canadian as well. So our population, it's a smaller population. I would say most of those people are at the front of the conversation globally. So they were talking about, what they knew as well. I think that was included. But yes, this is an international thing we've got going on here. Artificial intelligence is, all around the world. So very important point.
We talked a little bit about that last night too. So in the topic of ethics, the intent of using AI, I believe, is an essential question. Have you seen what are the key questions to establish the foundations of an AI project?
So there are several competing ideas about this. And I think it depends. I agree completely. What is the intent? But intent is not the only thing. And anybody who studies implementation science would point out that we can have great intent, but the way it actually plays out in the world is not the same. So there are, like I said, there's some work about what is trustworthy AI. I would point you down that direction. It's 7 principles of setting up AI in a trustworthy way. And so that means, does it work in systems the way that you expect it to work? Does it have the guardrails and the boundaries? So I would look there, thinking about trustworthy AI as giving you a set of guardrails or key. I wanted to say one last thing I forgot to say in the talk, if I can. I think this is a really helpful thing. One of the subject matter experts said to us that every clinician knows something about pharmacology. They're required to learn that. And he really wants that everybody should learn something about AI so that they know if somebody is trying to sell them he called it magic beans, that you would know what kind of questions to ask. And so I think this point about what are the foundational principles are really important, and they will vary depending on your context: education, healthcare, car manufacturing. So I hope that is somewhat helpful. And again, thanks for showing up this morning so early and having your questions. And I'll stick around.
Yes. If anybody wants to stick around for a few minutes to ask more questions, that's great. I realize it is 8 o'clock and we are ready to get rolling with our day. I hope you all have a wonderful day. Again, if anybody has any questions, feel free to stay on for the next few minutes.